afternoon, everyone. I am Gail Birks, your host for this month's edition of the Readiness Factor. There are so many things that we can talk about, but today's show is very personal to me because I am at that age where I have to start looking at other services, other activities, other things in terms of how I govern my life. And in the Readiness Factor, we bring you the experts in the field to help us as business leaders, professionals, entrepreneurs understand how to sustain ourselves for the success that we desire in whatever chapter in life we exist in. And today's show, we are going to be talking about the ABCs of Medicare. That's probably one of the scariest words that we have to say out here, especially in this age bracket that many of us are entering into. And to help us to understand this journey of Medicare compared to some of the other heirs and aides out there, I've got this wonderful lady who's decided to join me today. Her name is Tionna Streeter. And Tionna is my Joan of Arc. Let me put it like that. She is a warrior. She has given me the insight and the calm that I need when it comes to this whole world of Medicare and understanding the difference of the other. Tionna, my friend, welcome to the Readiness Factor.
Thank you, Gail. I appreciate it. Thank you for having me. And thank everyone for joining. This is exciting. I'm happy to be here.
Yeah, and I'm so glad to have you. How did you get into this field of taking care of people like me who this is all above my pay grade? I mean, how did you get into this field?
I have a heart for people, and I saw how my parents struggled as far as learning and knowing more about their healthcare coverage, what is covered, what isn't covered, where can I go, what doctor can I see. So I said, okay, I'm going to take the test. So I took the test, and I'm licensed in 17 states and Florida. I live in Florida, and most of my clients are in New Jersey.
Oh, wow.
But yes, so I
Wow.
wanted to make sure the elderly I say elderly, 65 is not elderly,
Thank
but
you.
it's considered to any Medicare beneficiary, I should say. I wanted to help them understand what they have access to in their area because it's very different from one place to another. You can have a
Yeah.
neighbor live in one zip code, you live in another, and the plans that are available to each of you are totally different.
So let me step back on that. You just said if I live in one zip code and someone else lives in another, what's available is going to be different. How is that?
It depends on because what Medicare is a funded, Medicare is a federally funded insurance availability for
Mhm.
some disabled people, depending on the disability. It's not just 65. It's disabled and 65 plus.
Mhm. Mhm.
Yes.
Mhm.
So different areas are fed different money.
Mhm.
So the private companies that are invested in Medicare, and we'll get to that a little later,
Okay.
it's called Part C. The
Okay.
private companies that are in that area that feed that area, they
Mhm.
actually offer different plans.
Okay.
They offer different plans. So every zip code is not the same. Medicare is not a one size fits all.
Okay.
Definitely not.
That's good to hear. That's good to
Hmm.
hear. So you know what? Let me back up because I have a tendency to just jump right in, both feet, both feet.
I love it.
People here, we're hearing so much and it's been politicized. So we're not going to go into the political side of it, but you hear so much about Medicaid and Medicare. What is the difference between the two?
The way I think about it is Medicaid, A, helps low income. Medicare, care helps the elderly. So that's how I help people to differentiate. And Medicaid, it's for the low income,
Okay.
how whatever age, doesn't matter. But
Hmm.
there are some different stipulations to qualify for Medicaid.
Hmm.
Medicare is for the disabled and the 65 plus.
Got it. Got
Yeah.
it. Got it. Got it. Okay. Because
So Medicaid,
that's,
I'm sorry,
go ahead.
Medicaid is you apply through your state,
Mhm,
and Medicare you speak with a licensed agent.
mhm. Yeah, because you're hearing so much about governors and legislators in certain states not accepting their Medicaid allocation.
Yeah,
So I would wonder if that is problematic about it. They're already starting to send questions over, but
I
it seems
see.
like we're touching them. So, that would seem to me to be problematic. And I know every time I get my paycheck or I have to write a paycheck, I'm seeing that little allocation for Medicare. So, you always wonder, well, where is that money going? Is it being set aside for me, or is it going into a general pot? How what's happening? Because I want to make sure that my dollars are there when I actually have to go in and request for my allowance.
Yes, that's a very good question. So, in order to qualify, there's a Part A of Medicare. Part A is the inpatient portion.
Okay.
There's a Part B, which is the outpatient portion. So your Part A is your hospital visits, your skilled nursing facilities. Your Part B is the outpatient. That's the preventative, the doctor's visits. Then I'm going to go to Part D, which is just prescription drug coverage. That's all it is prescription drug coverage, Part B. And then I'm going to go back to Part C, which is A and B combined. So inpatient, outpatient combined. Plus, some of them have the Part D, which is the prescriptions. So that's like an all in one plan, the Medicare Part C. They call them Medicare Advantage plans, and they're provided by private companies like Aetna, Humana, United Healthcare, Clover. They're provided by different companies.
Okay.
So your Part A and B are just original Medicare. Your Part C is Medicare Advantage. Your Part D is just prescription drug coverage. So when you ask about Medicaid and Medicare, there are plans that are both combined. Medicare, they call them BSNP.
What? I'm sorry.
D is in Delta, S is in Sam, N is in Nancy, P is in Paul, BSNP plans.
Hmm.
And they are special needs plans.
Okay.
Dual. They used to call them Medi-Medi. They don't call them that so much more, like Medicare, Medicaid. But yes, there are when you qualify for Medicaid, there are plans in your area, hopefully, that combine Medicare and Medicaid. And
Okay.
that can actually they have the plans are very benefit rich.
Okay.
Medicare. So I'm just going to back up a little bit. So when I said there's a Part A and a Part B, so A,
Hmm.
outpatient, B, inpatient. Part A and Part B, they're considered to be original Medicare when you don't have a private insurance company involved. So that's Part A and Part B. Part
Okay.
A in, Part B out. And those are original Medicare. So, if in fact you want to stay with original Medicare, please be sure to learn the ins and outs of original Medicare, the deductibles, what you have to pay prior to original Medicare kicking in. There are deductibles for some of them, all different types of plans. There's also, I want to highlight Medicare supplement plans,
Okay.
Medigap plans. Some people don't fully understand. They think this is that and that is this. Please fully understand. You got to get it. You got to get it. Don't take a plan. Don't enroll into a plan until you fully understand what it is that you have.
Okay.
That's where I take the time to sit down. And what's important is you have to be able to list your prescriptions, your doctors that you want to keep, get all the information for the agent so that they can help you. And this year, if you're already on Medicare, this year, some people have been updated. Well, 2024, some people were sent updated Medicare cards because of identity theft. So
Oh,
it's
wow.
very important to, yes, to pay attention to your mail. So Part A and B, original Medicare. C is Medicare Advantage. D is prescription drug plans. Now, if you have original Medicare, the A and the B, which is the in and the outpatient, and you add a Part D, do not let someone just let you stay with original Medicare. Please add your Part D. You will have a monthly premium for that Part D. You may have a prescription deductible for that as well. And then you'll pay for your prescriptions that way. So
Okay.
definitely, I'm saying that because I know of a person who, when they turned 65, they went into a Medicare supplement plan, which is a Medigap. They did not
Mhm.
get Part D, and now
Oh,
they're
wow.
80 and they need prescriptions.
Okay. I
So
got a
he has to
question.
pay. I
Go
just
ahead.
want
I'm
to
sorry.
bring that he has to pay a
Yeah.
penalty, a
Oh, wow.
1% penalty for every month that he was not covered. So
Not
no,
year, but month.
not many people tell you,
Oh,
but
my
there are
God.
penalties if you don't sign up for Medicare when you're qualified, when you're 65. So pay attention to that. And
Okay.
any questions you may have, I'm always here to answer them. My information will be given later on. But go ahead, Gail. Sorry.
I've got somebody that says, if I'm still working, should I sign up for Medicare at 65?
That is a personal Medicare is it's not a one size fits all. That's a personal question. We can sit down and talk about that. But there is a benefit to it if you're able and you sign up for Medicare at 65, Part A, that's great. Part B, there is a monthly premium. So you want to wait to sign up for Part B. But that's really not a general question that I can answer broadly. It would have to be personal because it depends on the amount of employees that your job has, and because as far as whether your job or Medicare will be the primary payer. So it's a lot of ins and outs, a lot of tips and tricks to Medicare. Definitely.
So if they turn, okay, can you opt out of Medicare if you are covered under the VA?
Under the VA, it all depends. You can, that's a great question. Can you opt out of Medicare if you're, yes, you can. If covered by the VA, how? So just by prescriptions or full medical coverage?
Turn on your mic. Hey, Veronica, long time. Turn on your mic so you can ask the question.
I'm sorry. Hi, how are you? Long time.
Hey,
Great.
great.
How are
If
you?
you're good, if you're covered under hospitalization and prescription, can you opt out after 65?
After 65. Um, I'm trying to think of different instances where I've seen and it didn't benefit someone. I just want to make sure that I give you the 65 VA. I haven't seen anyone do that. I
Okay.
haven't. That's a great question. I will definitely get back to you with that answer.
Thank you.
If you would just reach out to me and I'll let you know.
Thank you.
I got another
60
question for you, and it's how can I help my employees understand Medicare better?
Medicare 101s given by licensed agents. Like I said, it depends on how many employees the company has. And You can always go to Medicare.gov. They'll give you information about Medicare as well as in your specific area. That's a completely unbiased resource to tap into, Medicare.gov.
You know what? Sometimes though, and I think this is how you and I got connected. I get so lost in those websites. They are so overwhelming. And sometimes I wonder, okay, whoever put this together just did not want me to find anything that I came in here to find, for real, for real. And when I was introduced to you through a mutual colleague, I knew I was going to be in good hands. And you know, when you're looking at this kind of chapter, this kind of resource, and folks, it is always good to have somebody in your corner who understands, one, how to maneuver those websites and steer you in the right direction. But sometimes there is information that you need to know and understand that transfers over to some of the other areas, from a layman's perspective, that you need to understand. Because we've had some real generic conversation about the Social Security side of it. And that took me on a whole different journey of investigations, but I went into it a little bit more educated, if you will, and less fearful, because this is frightening. This is very much a mortality journey that we are doing right now. I am eligible for Medicare. Oh my goodness. That means I am officially going to be a senior citizen. Somebody's going to call me old, and I am not going to like it, but it is what it is. When you talked about those penalties. What I've got a question before I ask that one. How, when you talk about avoiding the penalties, that's kind of frightening, because when you think about all the years that you pay in, and you're trying to make this big decision about which plan to choose, which one to not choose, which one to opt out, how can we make sure we don't put ourselves in a position where we're going to be penalized? That's scary.
Right. It is. It can be. Don't miss your deadlines. So think about it this way. When you're turning 65, you have a 7-month window without penalties to enroll into Part A, Part B, and Part D if necessary, or C. But you have a 7-month window when you're turning 65. That's 3 months. Say your birthday, what's today? February? 3 months prior to your birth month, and then February, and then 3 months after, March, April, May. So it all depends on, you have to meet your deadlines. And with that being said, there's also a Part B, as in boy, penalty, and Part B, and there's a Part D Delta, which is Delta, think of drugs. That's just prescriptions. Yes. B as in Bravo, that is your outpatient. So if you don't enroll into your Part B, there's also a penalty, which is 10%. So some people, when they turn 65, they say, oh, no, I don't need that. I don't need anything. Like the person I spoke of that didn't need the drugs, finally on prescriptions at 80, not 65, and now has to pay the penalty. And every year I have to explain why that payment is due. It's so funny.
When you say 10%, 10% of what? The salary that I have earned, or?
No, it's 10% of Part B, Bravo, 10% of your, let me think. I'm sorry. I'm Bravo. Please forgive me, guys. I'm having some medical issues, so I'm trying to keep my thoughts clear, and I'm trying to grab them, and 10% per year delayed. That's the Part B, Bravo. So if you turn 65 and you don't register and you don't enroll into Part B until you're 38, I'm sorry, 68. See, there's my, until you're 68, then that's 36 months that you have to pay 10% of
Yeah.
per year.
Wow.
10% of those 3 years. So this year, the Part B premium is $185. It goes up every year, of course. Retirees of self-employed.
Now, are you locked in? I've got another
I'm sorry.
question.
I was
Are
looking
you
at that.
locked in? Yeah, are you locked in is your rate locked in once you sign up? You're not.
No,
Okay. It's like the
this is
other
not
insurance.
cable TV. It goes up every year for every beneficiary.
Oh my
And there are
God.
some, when there's Medicare and Medicaid involved together, Medicaid sometimes pays a portion of the premium, if not all.
Okay.
But
Okay.
every beneficiary pays Part B unless they have Medicaid. Or, yeah, unless they have Medicaid.
Okay. Wow. Wow. I've got some questions that are coming in as we're speaking here. One of our LinkedIn guests has said, I think you may have covered this already. And if so, it's okay. I can watch the replay. I joined a little bit late. Okay. What is Medicare Advantage and is it better than the regular Medicare? It's okay. We can
Yeah,
totally.
we can do it. So Medicare Advantage is called Part C, and it is Part A and B. A is inpatient, B is outpatient. These are different benefits. A and B is original Medicare. Part C, Medicare Advantage, that's what it is. It's provided by say, United Healthcare, Aetna, Humana, um, by a private insurance company, the benefits, and so sometimes it includes extra benefits. Just like the original Medicare, A and B does not include dental, vision, or hearing. But some Medicare Advantage plans do include dental, vision, and hearing. So
Mhm,
it's just A and B together plus extra benefits.
mhm.
And it deals with networks in and out. That's
Yeah.
another thing. Pay attention to the networks. There's in network, there's out of network. Just like think about the insurance you had before 65. So do I want to keep my doctors? What network is my doctor in network with this plan? That's
Yeah.
why it's important to go over your, like I said, your prescriptions, the doctors you want to keep, your pharmacy with your agent
Mhm.
in
Yeah.
order to stay with whom you want.
Yeah. Yeah. And
But
that's you.
also remember that it changes every year. So the
Yeah.
plan you chose for 2024, 2025 may change for 2026. So you got to pay attention. You got to sit down. It's a benefits checkup. Sit down with a licensed agent and do a benefits checkup every year.
Guys, I want to tell you, I've already told Tionna, you are stuck with me for life. And you
Thank
know,
you.
the just because just the insights and how you could potentially get nickel and dimed. It is it and as a self-employed person, especially, I don't have that luxury of the internal HR department who does all of the legwork for me. But and I see that we've got a question from somebody who is self-employed and recently retired. Are there any benefits or programs specifically for retirees or self-employed people, or do they even differentiate at that point?
No, they don't. There are, I have not that I've seen, there are no special programs for self-employed. It's just if you've been self-employed and you do not have 40 quarters of contribution, we were talking about this earlier, Gail, as far
Yes,
as looking at the
yes,
paychecks, looking for
yes.
Medicare, you need 40 quarters of that, which is 10 years, in order to qualify for the free Part A. It's free if you have 40 quarters. If not, there's a premium attached to that as well, which can go up to $505. All depends on your income, especially, and also for Part B. Your income does determine how much. I said it was $185. Your income determines how much you pay for Part B.
Yeah, yeah, yeah. And I started counting back, and I'm like, okay, I think I'm good.
Yes.
I think I'm good. I
And
think
you can always check the Social Security site if you have an
yeah,
account. If not, create one, and then you
yeah,
can see exactly what you've contributed, if
yeah,
it's 40 quarters or not.
yeah,
And they'll
yeah.
tell you how many you need if it's not 40.
When I work with entrepreneurs, we have an entrepreneur academy, and part of that financial component that we do with the entrepreneurs or those who aspire to be entrepreneurs is I always tell them, please make sure you pay yourself, not because of right now, right this minute, but down the road, you are going to need to have that proof that you have paid yourself, even if it's 50 cents. You've got to show that you paid yourself. We'll give yourself more than 50 cents, but you know what I mean?
Yes.
And I have run into so many people who have not done so. And so, that, and now they're at this stage in their lives where they're looking to collect the benefit of having arrived here, and there's not a whole lot to report. So thank you for that. Thank you. I've
Yes.
got
And
a
also,
go ahead.
if
I'm sorry.
you're married and your spouse has contributed 40 quarters, you can use that. You don't necessarily, if you're married, it benefits you to actually include your husband, your wife's 40 quarters.
That's interesting you say that, because you have a lot of couples that are common households, but they're not that traditional marriage. How does
Right.
that work? Does that
As far as Medicare is for individuals, period.
mm-hmm, mm-hmm.
It's not for couples. So the only thing that would include a couple would be the 40 quarters.
Got
After
it.
that, nothing.
Got it. Got it.
It's he has his plan, she has her plan, she has her plan, she has her
Everybody's
plan.
good.
It's individual. Yeah, it's
Yeah.
individuals.
Everybody's
That's
good.
why it's no one size fits all. It's very specific to every individual.
Okay.
Like I
Gotcha.
said, location, prescriptions, pharmacy, doctors, hospitals. It all depends on where you want to be, who you want to see, and how you plan to use the benefits. So pay attention.
Okay. I've got another question that's come in from LinkedIn for you. And it says, thank you for this information. Most don't realize how important it is to have these conversations until it's in your face. Thanks again bringing up the topics that are outside the usual business topics. You're very welcome, and bringing experts into your audience and opening things up for our questions. That's what it's all
That's
about, because
awesome.
it's all about being ready, folks. That's why we call this the Readiness Factor, and we want you to be comfortable going into those chapters of life, of business that you encounter. So it is my honor, my pleasure. We are just about out of time. And are there any other questions or comments that you all have for Tionna before we share those most important digits that they need to know, my friend, to be able to follow up with this customized conversation with you? I just think that there is never enough time in the day to do what we need to do. But if we can take a few minutes out of our day to get some golden nuggets like what you're sharing with us, I am always grateful. And folks, I've
Awesome.
just put her contact information on, but Tionna, why don't you share that with the audience so they can hear it as they can read it as well?
Okay. Thank you, Gail. So to reach me, you can reach me by phone at 386-627-3949. And again, my name is Tionna Streeter, Tionna Streeter, Streeter. And my email address is ts.insured, insured @gmail.com. And you can reach me by calendar. So to set up an appointment to speak about Medicare, there has to be you would have to sign a scope of appointment. If you set up an appointment with me, email me, call me, I'll send you a scope of appointment. And then I have to wait, as an agent, I have to wait 48 hours before I can contact you. So that you're protected as a Medicare beneficiary. The government does its best to protect you. And you can click on the Calendly link to set an appointment if necessary? So that is, I'll read it if you want to write it. https:// calendly.com/TS, like my name, Tionna Streeter, hyphen insured, INSURED, slash, well, I think they're forward slashes, 1-hour. So you can reach out to me. It's best by phone. You can talk, you can text, whatever you need, but just know that you have to sign a scope of agreement and we have to wait 48 hours to set an appointment. That is definitely something that would put my license in jeopardy, and we're not going to do that. Yeah. Thank you all for having me, Gail. I love you. Thank you, honey.
One more question before you go, because, everyone, they love the golden nugget. Is there a cost for your service?
No, it's a free consultation. There is no cost for me to speak with me, for me to help you, to guide you. There is no cost. The insurance companies pay me.
See, they were very polite. They didn't ask that question, but you know me, I'm going to put it out there on the table. We've got a final comment from Laura Marks, and it's thank you for the very valuable insights and recommendations in preparing for this next phase. Currently a proud holder of the Part A red, white, and blue. Other decisions pending. Have a great day. Thank you so much.
Nice. Thank you, Laura.
Ladies and gentlemen, we go through 30 minutes like the Niagara Falls falling down the cliff there. I want to thank you all for joining us this month for the Readiness Factor and the ABCs of Medicare and the things that you need to know. It's my hope that you do follow up with Tionna and get those nuggets, continue that conversation, and let's make sure that we are covered properly when it comes to this next chapter that many of us are entering into. We'll see you next month on the second Thursday at 2 p.m. Eastern Time. And stay prosperous, stay healthy, and most importantly, stay safe. We'll talk to you out loud real soon.